Mike Crook show with our host Mike Crook. Mike, here we go. You talked about the last couple of weeks we just on the podcast more about LifeWave and the technology, but now we have our guest that's going to talk more about it on the medical side.
Yes, we've got with us Dr. Joe Duggar from Searcy, Arkansas, who's going to share some of his experiences with the technology as a practitioner. And so I would love to instead of me introducing Joe and giving his credentials, I would love for him to do it for himself if you don't mind. So Joe, would you introduce yourself? Take your mic off of mute and hop in.
Yeah, thanks, Mike. Well, so I'm in family practice. I'm in North Central Arkansas. Been in medicine for over 30 years, practicing in my hometown. Always have had a wellness focus with my practice, and especially in the last 7 years, have moved into a direct primary care model, which allows me to really truly be wellness focused. And we do emphasize lifestyle medicine, so we like to get people off of their diabetes meds, their blood pressure meds. We want them to eat healthy and exercise, so we try and facilitate that as best we can. I've always been interested in stem cells. Adult stem cells have been very promising. We can see a lot of regenerative and anti-inflammatory benefits to those, but the problem has always been the expense. And so I heard about this technology through a sister-in-law who asked me to look into it over a year ago. And so I did some research, and my goal was to tell her if this was legitimate or not. And so after looking into it, I was very intrigued, and so I went ahead and started using them myself. I started recommending them for others as we got some more experience. I networked with some other physicians that were down the road a little ways that had experience with it. And right away, we noticed a lot of benefits to the stem cell activation technology with anti-inflammatory benefits. I have two of my four kids that have inflammatory bowel disease. One has ulcerative colitis and one has Crohn's. And so I had seen a case study where a person had had complete healing of their Crohn's in a short amount of time. And so I was intrigued by that too and wanted to certainly try it for them. But I've seen, so both my children are much better now. My son is actually in complete remission, and he was on Remicade for a year, which is a very potent drug that we use sometimes for ulcerative colitis. And after a year of that therapy, he had no improvement. His repeat colonoscopy still showed severe inflammation. So he had started the stem cell therapy. He was between treatments, so he'd stopped Remicade. He was transitioning to one called Skyrizi, and we were waiting for approval for that drug, which was $20,000 a dose. So he had to have patient assistance for that. So in that limbo period, in 2 weeks on the stem cell activation technology, all his symptoms had cleared up for the first time since he started having problems with the illness. He was symptom free. His repeat colonoscopy was normal. His biopsy was normal after about a year on the stem cell activation therapy. So we've been very impressed with it. I would say I could tell you a lot of different, you know, uh, things that I've witnessed in patients and friends, but the most impressive thing that I'm seeing is with neurodegenerative diseases. So we're seeing people with Parkinson's whose tremor goes away for some very quickly. One man, his tremor went away within a week, and he had severe tremor. He couldn't feed himself. He couldn't write. He couldn't work on his computer, which was his job, so he had to quit his job. So within a week, his tremor had gone. We're seeing people with dementia actually get better cognitively over time with this. A lot of things that are surgical problems, we're seeing those heal without surgery. Injuries to cartilage, like torn labrums, torn rotator cuffs. Um, so it's just, I mean, the list goes on, but there's such a dramatic improvement. Here's the big thing: everybody's going to have inflammation, and that's the thing. I think we've got to figure out, if you really want to stay healthy and you want to move into your 80s and 90s and beyond, you've got to have some plan in place to fight inflammation. And inflammation is the killer. I mean, if you look at cardiovascular disease, if you look at diabetes, if you look at cancer, it's one of the huge facilitators of all those diseases is inflammation. And a lot of times it's a triggering event that leads to something catastrophic like a stroke or a heart attack. So dealing with inflammation is key, and taking ibuprofen 800 milligrams 3 times a day for 30 years is not a good strategy. Uh, that's what we default to, something like that. So that's what was the most exciting thing to me when I first discovered this was here's a plan for anybody and everybody that will allow us to have a strong anti-inflammatory benefit. We're actually activating our body's own stem cells. So we're enabling our body to heal itself. And obviously we can do um, better. Typically, most of us can with how we eat and our exercise. But this kind of provides a ray of hope that things will get better. And so for a lot of people, it's motivation to start doing those other things as well. So anyway, that's kind of the nutshell version of what we're seeing and why we're so excited about it.
Wow.
So
Uh,
I was going to ask a question here. So in the practice, you're recommending to patients to use the X39 patch, which among other things creates a GHK copper peptide, GHKCU copper peptide, and then you also are there other of the patches that LifeWave manufactures that you use in practice, or you've used on yourself or with others?
Yes, I've grown in my understanding of the other patches. It can be a little overwhelming when you first start looking at all the different um, therapies that LifeWave offers, and it's not that many, but there's a number of patches, and so the X39 was the main one that I focused on, and that's typically what I will guide people to for starting. But there is one called Aeon. It's AEON, and it reduces cortisol levels. And in conjunction with the X39, that combination tends to be the best one for most people, especially if there's an inflammatory condition already at work in their body, like rheumatoid arthritis or inflammatory bowel disease, which is mainly Crohn's and ulcerative colitis. Anything like that, then I usually recommend starting with the X39 and the Aeon because of the added kind of jumpstart benefit on inflammation. The X49 is another stem cell activator that is a newer patch relative to the X39. It's been around for a few years now, but that gives you the added benefit of some essential amino acids. It causes the cells to produce a different copper binding peptide than the X39, but it helps with muscle mass increase, especially in someone who's exercising regularly. Helps you to recover faster if you're working hard physically or you're exercising. So the 49 with the 39 is a combination that I think most adults will benefit from that because the trend is for us to lose muscle mass over time, and our muscle mass is directly tied to longevity. So if you want to reverse that trend, which is very doable, then you want to figure out ways to, at a minimum, maintain muscle mass, but best case scenario, increase muscle mass. So I like the X39, X49 combination, really for everybody, and then the Aeon in addition to that. So those three are the main ones, and then I'll recommend sometimes Ice Wave, which is going to help with acute pain. If people are having trouble sleeping, there's a couple of options there for that. There's one called Silent Night. But when people are first starting, I really try and help them, get started on the X39, possibly with the Aeon together. And for various reasons, we'll add in the 49 and add on some others as we go, as needed.
hmm.
So you got some your own personal experience of your own medical records that you said you were willing to share, and hopefully we can get these on screen. But in addition to that, what are the things that are markers that if someone was looking to medically see if there is a difference before the patches and after the patches, that they could be able to add to a regular blood panel, and if they're going to add them to a regular blood panel, what do you think is usually the cost for them to do that? So can you address that? And then if you can pull up your numbers, I would love to show the audience that as well.
For everybody, I recommend as a part of their annual physical, we typically do most of these tests, but we'll do a complete blood count. We'll do a comprehensive metabolic panel, which shows blood sugar, kidney function, liver function, electrolytes. We'll do a lipid panel, which shows all the cholesterol numbers. We'll do a hemoglobin A1C, which shows their average blood sugar over the previous 3 months. We'll do a thyroid test, usually just a TSH. In men, sometimes we'll check testosterone, but we'll always check PSA as they hit a certain age. And then, in addition to that, when we start the stem cell therapies, I recommend that we do some inflammatory markers. And it depends on what that person has. If they have rheumatoid arthritis, then we'll check some of the specific markers for that. But in general, for inflammation, we'll check a C-reactive protein. We'll check a SED rate. Sometimes we'll check a couple of other things, but those are the main ones. They give us sort of a general picture of what inflammation's, what level of inflammation they have. And then after they've been on the therapy for 3 months, this is variable. It's not a hard, fast number, but within 3 to 4 months, we'll typically check another lab test to just see if those inflammatory markers are changed. And so I'll try and pull mine up here, my labs, but I started having joint inflammation, probably at least 5 years ago, was doing the ibuprofen and then transitioned to longer acting prescription Celebrex, diclofenac, all anti-inflammatory medicines. It would keep it at bay, but it was still a daily problem. And at times it would flare up and just even keep me from sleeping. Hands and wrists, knees, sometimes shoulders. And it didn't really occur to me that it might be rheumatoid arthritis. So as a doctor, my self-diagnosis skills were not great there. And but my dad had rheumatoid arthritis. My sister struggles with it. And so I finally checked my numbers, and I did. I had all the markers for rheumatoid arthritis. My inflammation was really high. So all those markers I mentioned were 3 or 4 times normal. And so I started the stem cell activation therapy. I stopped all the anti-inflammatory medicines and checked my numbers again within a short time. I think it was 2, maybe close to 3 months, and all my inflammatory numbers were normal. The marker for rheumatoid arthritis, the main one, had been cut in half, which surprised me. So just a dramatic response. And let's see if I can pull those up. We'll experiment here, see what my skills are. Don't screen share yet because I'm not there.
I gave you the ability to share screen. So you hit that green button on the bottom, share.
Okay.
And you want to share the full screen. You don't want to just share one part of your computer. You want to share the desktop so you can have access to everything.
Okay.
So while we're talking, Mike, it's amazing to look at the story, right? And these are the stories we're going to have on the Mike Crook show that really blow people away of what the X39 and the technology can do.
It's amazing. We're seeing across the board inflammation going down with everybody. And inflammation, we know, is the beginning of these things that the medical community calls disease processes. And so seeing inflammation go down is the most important thing for people to do. Now, there's a lot of other things that they get as benefits from what that copper peptide is doing and what their stem cell activation is doing. But that's a beginning early issue that you're dealing with, and it's something that somebody can say, well, I know that my inflammation markers before getting on this technology was this, and now 4 months later it's this. So it's a way for people to test, and if they're curious, to see where things are. And they may have normal normal inflammation rates. And so that, may not be the thing for them, but usually there's something. And then before we go way too far down the road, I want Dr. Duggar to also address X2O water machine and how that's affected inflammation for him as well. So he's got it up on the screen.
Absolutely. Dr. Duggar, you can make this larger by going up to the top of the screen and there's a plus sign and you can make it larger. And then you just move it from the spots and all that stuff. Okay.
Okay. Are you able to see it?
Yes, we are. Yes.
Okay. So these were the initial labs. C-reactive protein is 0.6. So these are some markers of rheumatoid arthritis and autoimmune issues. So the anti-nuclear antibody was positive. This anti-CCP antibody is specific for rheumatoid arthritis. You can see it was 25.5. Normal is up to 0 or to 2.9. And so let's see. That was the first bit of labs, and then this one might have just been 6 weeks later. Shows you some repeat labs. There's more on here, but I'm going to go to those specific ones. So the C-reactive protein is now down to the normal range, 0.3. Can you see that?
Yep.
And then
but you want to keep making it larger.
Okay.
Because they're not going to be able to see it that much. So you got to keep going. And so it has to stay at about, keep it bigger, larger, and that'll work better. And then you could scroll down. You just have to scroll it.
Okay. So there's the C-reactive protein. It's normal range, 0.3. Here's the anti-CCP antibody. So it was 25 in the first test. Now it's 12.1. SED rate is now 6. I don't remember what the one was in the last bit of the labs, but that's well below the normal of 20. And I can tell you, and I had started using the X2O, which is the water that the water filter that LifeWave makes. What that does is it actually infuses the water with photons and hydrogen, and so it has a more immediate result of stem cell activation because the water is taken into the cell. And it's so important when you're using the X39 and these stem cell activation patches to hydrate well. And so the X2O helps you to do that by facilitating that intake of water and light or photons into the cells.
Oh, so explain how much, like when you're taking this technology, there's more to it than just putting the patch on and saying, okay, it's going to do magic.
Right. Yeah, I think, we're just now, the water filter is not available yet for everyone, but it should be in January. So we're just now getting some experience with it and finding out what it will do. But hydration, whether you're using the filtered water or just tap water, is going to be key. And it's just people who don't have as good of a result immediately or within their first 30 days. A lot of it, the time, it's because they're not hydrating well enough. And so
how much hydration do you recommend?
I usually recommend about a gallon of water a day, depending on the person's size, but that's 8-ounce glasses. That's been a recommendation for a long time for adults. Very few of us actually drink that much water.
I'm trying to see how much do you think's in this, if you can see.
That's probably 16 ounces.
So 16. So how many of those usually you need to drink? How many of those? 4.
You need to drink 4 a day. Yeah.
Mm-hmm.
So that's, that a lot of people now are more conscious of that, and they're carrying their water, their Stanley or whatever the cup is with them. Yeah. So, I think that's the trend, but it's so important to do that. And there are some nuances there depending on, if you're working more in the heat or you're sweating a lot, or body size can have something to do with that. But in general, we do need to drink more water than we are drinking.
So what about also other technology? And you can stop share if that's all that you were going to share right now, Dr. Duggar, and I can take you off that stop share. Do you see like what else using the X39 do you recommend? Hydration is one. And Mike, this is amazing because now we're finding out ultimately that you put the technology on, you need to really still do other things, exercise, do different things to see the progress that's being made. But from what Dr. Duggar has seen, what else do you recommend?
Yeah, I think getting rid of inflammatory foods is important, and sugar is a huge one. So I've been recommending that for a long time, but you can really see it working with in conjunction with this technology. If you're willing to do what it takes to eat healthy, which is for most of us more challenging than it should be, I'll say. Um, Getting rid of added sugar, or at least minimizing that. Um, this is probably stepping on some toes, but just looking at what you eat and what you're willing to give up is a key part of that. And I usually tell people, be realistic, but also, make the changes that you need to. So starchy foods, there are some advocates that would say you need to go 100% plant-based with your diet. Most of us aren't willing to do that, but a lot of the inflammatory foods are going to be, um, in
Yeah.
animal um, animal-based foods. But I think if you just the low-hanging fruit is added sugar, getting rid of that. There's several good resources out there. There's a book called Body on Fire by Monica Agarwal. She's a cardiologist, and I like it. I recommend it a lot because it does lay out a path to getting rid of inflammatory foods. She's an advocate of plant-based diets, but she really has done a lot of the work to tell you
Mm.
these are the foods you should eat, these are the foods you should not eat. Whole 30 is another good uh, book and diet that you can follow. That's more of a lifestyle, not just a I'm going to lose weight and do this for 3 months type deal. And Whole 30 gets rid of all the sugar and the starchy carbs in the diet. So that, and then definitely exercise, weight bearing exercise if you can. If joints are too um, degenerated to do that, then we'll recommend swimming and biking and rowing and some non-weight bearing things. But a daily or at least 5 days a week routine of 15 to 30 minutes. It doesn't have to be a long time of just good movement. Some strength training incorporated in that for 100% of people needs to be part of the regimen, again, for muscle mass. So those are all just the basic things, and figuring out how to incorporate that into a busy lifestyle is the key.
Well, pretty interesting stuff. Mike, your thoughts?
Yes, I'm just the more I learn, the more I see, the more I experience with this technology. It never ceases to amaze me. It just keeps going on, and so seeing his results, seeing the using the water machine myself there when I was out at his clinic and with him, just amazing results. So there's a lot more to come. It's just a lot more to come about what this do and hacking, figuring out what things you do with your body are just it's just paramount. If you're gonna live longer and live healthy all the way through, you've got to do some changes. And adding this technology, this patch, this X39, X49, the Aeon he was saying, other things that they have as part of their technology, it's just one of those things that you look at and you say, okay, I'm going to add this into my lifestyle and do something with it.
What is the so I want to learn a little bit more, Dr. Duggar, about the X49. I know a lot about the X39. Can you tell us a little bit about the X49?
Yes, so it's going to increase the AHK-CU peptide, which is also a copper binding peptide. The X39 increases the GHK-CU peptide. So that's the only difference really as far as the copper binding peptides go. And what AHK-CU does, it helps increase alanine, which is one of the essential amino acids. Um, it works really to help improve muscle recovery. Um, but that does translate also into a cardiovascular benefit because the heart is a muscle. Anyone who's had cardiovascular disease, who's had a heart attack, I think those heart failure, those are the ideal candidates to add in the X49 as well. But what LifeWave does is they recommend those two, the 39 with the 49, to help facilitate, just faster recovery for not just performance athletes, but certainly for performance athletes. My two boys played college football together on the same team for 3 years, or actually, I guess 4 years, and then my oldest son has graduated. But when they started using this over a year ago, they were just about to go into their season, and so it was right at the beginning of season. So they started using them and saw great results with their recovery time. And so we had at one time they have 21 together with all our cousins because my wife has a big family, so they're all close in age. So at one time, I guess it was 3 years ago now, maybe 4 years ago, we had six of the cousins all playing on the same college football team, which was pretty phenomenal. And so a lot of the kids are athletes and play different sports. And one of my nephews is a quarterback, and then he was in high school. He was on a team that was a prolific passing team, so he was always working his arm, and he had to ice his arm and his elbow daily for a couple of years from the time he was a freshman in high school through his senior year. He started using this combination of the 39-49 his senior year of high school, and he didn't even ice his elbow a single time that season. And so he went from icing it daily to never having to ice his elbow. So, the soreness factor, the just typical recovery time that you need after a hard practice or a hard football game or a hard workout, all those things change when you're using it. And so it's a pretty dramatic difference, before and after when you start using that.
All right. Mike, any other questions for Dr. Duggar?
Well, I really appreciate your time this morning. It's always just great to have those healthcare professionals getting on and talking about their own experience. Sometimes it takes that for some people just to believe, just to say, well, is this real or not? And that's it's very valuable. So we appreciate your time, Dr. Duggar. And I know you got to go, so we'll let you go. Thank you for being on with us.
Yeah, thanks, Mike. Neil,
All
I
right.
appreciate it.
Okay. Thanks, Dr.